I'm delighted to be talking to Sarah Major from the International College of Oriental Medicine, better known as ICOM. Hello, Sarah.
Good morning, Samantha.
Oh, it's lovely to talk to you today about this subject. We're going to be talking about acupuncture. What is your role at the college?
So my role is the clinic director of the college, and the clinic is part of the college, sort of integral to the training of the students, but also provides external services to the community as an independent clinic.
Can you tell us a little bit about acupuncture so people understand exactly what we're talking about?
Yes, of course. Acupuncture is a very ancient art, the thread of which has sort of been developing over the last 2,000 years or so. It's a continually growing form of medicine and becoming very much more recognised as a valid and integral part of the medical system, really. Acupuncture, as everybody knows, is about putting needles into points on the body that start to stimulate the body's own defences and the body's own healing powers.
How long has the clinic been running now?
So the college began in 1972. It was began by a very sort of pioneering acupuncturist called Dr. Van Buren, who was Dutch and had experience of acupuncture as a prisoner of war in Korea. The college on its present site, I believe, opened in 1976. And next year we're celebrating 50 years of continual training of acupuncturists and of the clinic.
Oh, that's wonderful. Where are you situated?
So we're tucked down at the bottom of Greenhedges Avenue. Rather unglamorously, we always describe it as being between the tyre surface and Aldi. And Greenhedges Avenue is sort of known as a residential road. But there is this magnificent building which houses the college just down at the end of it. Originally, the college started at Dr. Van Buren's kitchen table in Gerrard's Cross, but pretty soon, after he began training acupuncturists, the course became so popular that a larger premises was needed. The college bought what is now known as Van Buren House in the 70s, and prior to that, it was a veterinary surgery.
Oh, a little bit different there.
There's always been a thread of medicine going through that building, strangely.
With acupuncture, what are the benefits?
Oh, goodness. Well, the benefits are far and wide and manyfold. NICE, the National Institute of Clinical Excellence, recommends that acupuncture as a very good remedy for knee pain and back pain. And I think it's most commonly known as a pain-relieving treatment. But we treat anything from headaches, digestive problems, skin problems, pregnancy, fertility. Really, we tend to be like general practitioners, really, and we'll turn our needles to anything.
I was going to say, is the college just for training students?
No, it's predominantly a training college. There are not so many training colleges in the UK. There's 5 or 6 currently that are up and running and training acupuncturists. We have about 40 students at any given time who are on a 3-year training course that is of degree level and is a very comprehensive course. So they spend the first couple of years of their training in the classroom, learning about the philosophy and the theories of acupuncture, but also getting a very, very comprehensive grounding in Western medicine. So anatomy, physiology, pathology, and to some degree sort of pharmacology, because the people that we treat, the people that come through our door often come with Western medical conditions. The training at the end of the second year then moves to a more clinical base, and that's where the clinic actually comes into its own, where we have real patients coming in, being treated by acupuncture students, whilst very heavily supervised by experienced acupuncturists in the clinic.
Obviously, you have appointment times when the public can actually come in.
Yeah, so there are several different threads to the clinic. We have independent practitioners. We have about 15 practitioners who work there. And the college is open 6 days a week, sometimes 7 when we have students working on a Sunday. But people can make an appointment either with an individual practitioner. We pride ourselves on having some of the best practitioners in the country working in the clinic. Or alternatively, we have lower cost options, which involves being treated by students at the end of their second year or throughout their third year as they develop through their training to become independent practitioners. Initially, people can be treated in groups, so 3 or 4 students with one real-life patient being supervised by a very experienced acupuncturist, through to the very last part of the training at the end of the third year, where the students practice pretty much on their own, but with a acupuncturist on hand to oversee their treatments. So all very safe.
I mean, it's a wonderful opportunity for people to have acupuncture in that way and know that it's all going to be supervised. It gives them that option, doesn't it? Whereas maybe they couldn't afford to have that before.
Yeah, that's right. I mean, unfortunately, acupuncture falls within the gamut of private medicine. It makes it accessible to a number of people, but the function of the student clinic is really to make acupuncture accessible to everybody. So treatments range from free up to £10 just for student clinics which are supervised.
Brilliant opportunity for people, isn't it? Now, if somebody had a bad knee, you don't necessarily put the needles in the knee.
No, we don't. The chances are that you would get some needles in the knee. And the purpose of that would be to draw the body's energy to that area and improve the blood supply so that the healing powers of the body can work. But we also consider the body as a linked, joined up network of meridians, which you can kind of relate it as a similar system to a blood supply or the nerve supply or the lymphatic system. It's just an extra system that can be accessed through the needles at certain points on the body. So, for example, for knee pain, we might use some points on the ankle. We might even use points on the back. But the likelihood is that there would also be points around the knee.
I can quite see why the training is quite lengthy, to train the students in this.
It's a very complex subject. And of course, many students come to the course with no grounding. We don't learn anything about Chinese philosophy in school, or not often, or not many people have the opportunity to access acupuncture as a form of medicine in childhood. So the students come in mostly quite green and quite unaware of what the philosophy is behind it. So there are many, many strands to the training. So there is the Chinese philosophy, then there's the Chinese medicine that has to be learned, but also alongside that, they have to have a very thorough grounding in what we describe as Western medicine, so traditional medicine, really.
What would you say would be the most common problems that you would treat?
Well, musculoskeletal stuff is the most common, but more and more, and particularly post-COVID, we're seeing a lot of mental health problems, and acupuncture is truly a holistic therapy and can work on all different levels. It can work very physically, but also on psycho-emotional conditions. So, yeah, things change. We will get quite often end-of-line problems. So very chronic conditions like Parkinson's or motor neurone disease, where Western medicine sort of has a finite ability to treat the cause or the symptoms. And so we get some very, very complex stuff coming through the door, not just knee pains and back pains, which of course is the sort of bread and butter. But yeah, some very, very interesting issues coming, and some things that can't be diagnosed or treated by Western medicine as well. And we will also see people perhaps who are having chemotherapy and will be treating the side effects of their chemotherapy. Yeah, some very simple problems and some enormously complex ones.
That is really good to know, Sarah. So what you'd say is you actually can treat both body and mind.
That's right.
Oh, very interesting. Is it painful?
No, it's funny, isn't it? Like, this is something that, as you can hear, always makes me laugh. People, I think, always equate acupuncture with their only other familiarity of needles, which is injections. I hate injections. Everybody hates injections. We think of the great big hypodermic needles and or having our blood taken. And in fact, the acupuncture needles are so tiny that you could drop 15 of them down the bore of a regular hypodermic needle.
Really?
So, yeah, the body barely recognizes them as they go in. They're so very fine and so very flexible that, of course, you will feel a very, very slight sensation when they go in. And that might feel like a slight pinch or a slight pulling, sometimes a sort of sensation of numbness or slight bruising. But I say to every single one of my patients, if this is painful, then you must tell me, because it shouldn't be. You might get some sensations, but pain definitely shouldn't be one of them.
Now, the college has a very, very good reputation.
Yes, it does. I think the fact that we have been there for 50 years and we've had a really steady flow of patients coming through our doors in that time, and it's grown a very strong reputation. We don't advertise. We rely on word of mouth and our very wonderful marketing lady and her social media skills. But yes, it does have a very good reputation. It's one of the longest standing acupuncture colleges in Europe.
And to think we have it in our lovely town of East Grinstead.
Yes, we're very lucky.
Very, very lucky. Now, you're coming up to be having a 50th anniversary.
That's right, yes.
Are you going to be doing anything special?
Yes, we're hoping to do lots of events next year through and starting really now to keep the profile of the college up and raise it to people who haven't really had any experience of acupuncture. We will be hoping to get our old students back and have some reunions.
Ah, that's absolutely wonderful. Thank you so much for talking to me today, Sarah. It's wonderful to hear about this. And a lot of people, I guess, don't know much about it, or they don't even know that you exist in East Grinstead, maybe. But let's hope our listeners are listening in and maybe be knocking on your door.
We would love to welcome them, Samantha.
That's lovely, Sarah. Thank you very much indeed.
Thank you.
Bye-bye.